Now we had seen about the restrictive lung diseases also. We'll move on to the granulomatous lung diseases. So starting with sarcoidosis. So sarcoidosis is an immunological condition which is having a type 4 kind of hypersensitivity, which is there is no etiology for this, and it is going to be associated with various HLA associated antigens like HLA-A1 and HLA-B8. And normal CD4 to CD8 ratio in the body will be 2:1. So CD4 is more than CD8. But here in sarcoidosis, especially in the BAL fluid, that is bronchoalveolar lavage fluid, if you see, the ratio is going to be, CD4 is going to be much more increased than the CD8. So the ratio will be 3.5, more than 3.5. Rather than being 2, it is going to be 3.5. And most commonly, this sarcoidosis, even though it is a multisystemic disease, it most commonly involves the hilar lymph nodes and the lungs. Other than that, the other organs which can be involved in sarcoidosis will be liver, spleen, skin, eyes, then also salivary glands, which can result in Mikulicz syndrome. Then even the bone marrow, wherein the phalanges are having a common predilection, that can also be affected. And sarcoidosis is associated with two syndromes. So starting with Hereford-Waldenstrom syndrome, this is also called as uveo-parotid fever. So there will be features of uveitis, parotitis, and parotitis associated with facial nerve palsy. And it is sarcoidosis is also associated with Lofgren syndrome. Herein we have skin manifestations like erythema nodosum, then bilateral hilar lymphadenopathy, then polyarthralgia also. Okay. So microscopically, how does a sarcoidosis look? So the classical feature of a sarcoidosis will be a non-caseating granuloma. So this non-caseating granuloma, it is going to be naked, meaning there is not going to be any lymphocyte collar in this. Lymphocyte collar, which is normally present in a granuloma, is not going to be present, and that is why the non-caseating granulomas present in a sarcoidosis is going to be called as a naked granuloma. Another specialty about this granuloma is it can produce vitamin D, and this vitamin D is one of the causes for causing metastatic calcification. So there will be increased serum calcium levels that can lead to metastatic calcification. And other than that, we can also have increased levels of ACE levels. Okay, on the serum, if you measure, ACE levels will be increased. And other two important features which we see on microscopy of sarcoidosis is formation of these asteroid bodies which are present in the giant cells. So here also we can have various type of giant cell, Langhans giant cell also. So in this giant cells, we are going to have this asteroid bodies. These are nothing but star-shaped particles like this, and they can also form some laminated calcifications like this part which is highlighted here. So this is the Schauman's body. So both asteroid body and Schauman body, though not specific for sarcoidosis, these are classically seen in sarcoidosis. The next most important kind of granulomatous disease which we see in India would be a tuberculosis infection. So tuberculosis, we all know, it is going to be caused by Mycobacterium tuberculosis. It is also called as the Koch bacilli and also acid-fast bacilli. So acid-fast bacilli because it on Ziehl-Neelsen stain, it is going to be producing this pink color bacteria. This is the image we had put. No, so this is the pink bacteria which is having a rod-shaped beaded appearance. So rod-shaped beaded appearance of this bacteria is seen on Ziehl-Neelsen stain, and this is because of the property of this tuberculosis, which is called as acid fastness. And this acid fastness is because of a presence of this phospholipid mycolic acid in their cell walls. So remember, acid fastness is due to the presence of mycolic acid of the tuberculosis. So we all have done Ziehl-Neelsen technique during our second year. So that was that in that staining we used heat method, right? We'll have to heat the slide after pouring the stain. But there is also a cold method of staining for tuberculosis, and that is going to be called as Quignon's staining. Cold Zn staining is also called as Quignon's staining. So what are the other acid-fast bacilli or acid-fast organisms which are present? So which can also stain with Ziehl-Neelsen's technique. So these are Mycobacterium leprae, Nocardia, Isospora, Cyclospora, Cryptosporidium, and hydatid hooklets. So it can be asked in all or true except kind of questions. So remember these examples also, which are these are examples of acid-fast organisms. So again, coming to TB back. So what are the types of tuberculosis? So we have primary tuberculosis, secondary tuberculosis, and disseminated or miliary tuberculosis. So in primary tuberculosis, it will be classically a child who had a primary first exposure to a tuberculosis. And the most common location of this will be a subpleural location, especially in the parts of upper part of the lower lobe and lower part of the upper lobe. So subpleural location is the most common part wherein you see a primary tuberculosis. And we have various named focus for this tuberculosis. So starting with Gons focus. Gons focus is this subpleural location seen in a primary TB. So seen in the lung. So what is Gons complex? Complex means something else is also getting added upon. So this Gons focus along with hilar lymph nodes, which are also involved with tuberculosis, the drained lymph nodes basically. So those are going to form this Gons complex. While Ranke's complex is nothing but calcified Gons complex. Okay. Moving on to secondary tuberculosis, this is reactivated tuberculosis. Primarily, the patient had an exposure and then now it is going to be reactivated. So here, classically, it will affect the apex of the lung, okay? Apex of the lung, and here there will be formation of cavities. So cavity formation, which you always see in a secondary tuberculosis. And the complication of this cavity will be, even if there is a cavity is formed and tuberculosis also being healed, later on there can be other fungal organisms which can develop in this cavity, forming an aspergilloma kind of a thing. So fungal ball can be formed. So that is one of the complications of this cavity seen in secondary tuberculosis. So under secondary tuberculosis, we have two types of named focus, which is supraclavicular location. You will call it as a pulse focus, while infraclavicular location you call it as an Asman's focus. Then moving on to disseminated tuberculosis, which is also called as miliary TB. So it gets its name because of the appearance of it like a millets. So we all have seen millets, right? It all looks like small grains. So there will be multiple small deposits of this tubercles, and this is a result of the hematogenous spread. So the patient's immunity is very weak and the TB has spread throughout the body. So what are the other focuses which we see in disseminated TB? So when there is miliary TB in the brain, we call it as rich focus. In the blood vessels, we call it as Wiegert's focus. Then in liver, we call it as Simond focus. Then in the apex of the lung, we call it as Simon focus. And in the spine, we call it as Pott's spine. Other than that, tuberculosis can affect literally every part of the body. In skin, you will have tuberculosis manifestation. In kidney, it can present with sterile pyuria. And in the heart, we all have already seen it had presented with constrictive pericarditis, right? Chronic constrictive pericarditis. Other than that, in acute presentation also, hemorrhagic pericarditis and caseous pericarditis. So all of the features, every organ can be involved by tuberculosis. So let's see about congenital tuberculosis. Congenital tuberculosis is the one in which a child newly born child, that kid is going to be having tuberculosis. How? Because the mother will be infected and from the amniotic fluid, by aspiration of the amniotic content, the kid can get infected, fetus can get infected, or it can also get affected via the umbilical vein. Okay. So to diagnose congenital TB, we use the Cantwell's criteria, and here usually the infant, which it will be showing the very first lesion within the first week of birth itself. So within the first week of the birth itself, there will be the first lesion, and the commonest lesion here will be hepatic lesion rather than a lung lesion. So in congenital TB, it is a hepatic lesion, which is the first lesion, rather than a lung lesion as in a primary tuberculosis. And other than that, all other causes of transmission of tuberculosis, like various other external factors after birth tuberculosis exposure, so that has to be ruled out to call it as a congenital tuberculosis. Then moving on to the third type of granulomatous disease, which is hypersensitivity pneumonitis. So as the name suggests, there is going to be some hypersensitivity to certain substances. So this is going to be a hypersensitivity reaction only, which involves both type 3 and type 4 hypersensitivity reaction, but the most commonest one will be type 4 hypersensitivity reaction, since it is forming a granuloma. So we all know granuloma is a type 4 kind of hypersensitivity reaction, right? So what are the examples of this hypersensitivity pneumonitis? So farmer's lung. So farmer can get exposed to actinomyces, can become hypersensitivity to actinomyces, which can be seen infecting the food grains. So that can cause exposure and cause hypersensitivity pneumonitis in a farmer, and that is called as farmer's lung. And other than that, pigeon droppings exposure or feathers, all of this can result in lung disease again. So that is called as pigeon breeder's lung. And humidifier's lung. So in AC or ventilators, again, you can get exposure to certain infections, also Legionella infections. Other than that, also you can get that humid mold can be seen. So molds can form in the humidified water or in the AC. So that can also result in pneumonitis called as hypersensitivity pneumonitis.